go on to the next theme of lumbosacral blocks. We will take a short break in the form of the GE Healthcare people would like to launch, would like to have their launch. So for that purpose, Mr. D N Shrinath, the National Business Manager of GE Ultrasound, would like to come to the podium.
From GE Healthcare, I'm the National Business Manager for Point of Ultrasound. Thank you, Aura, for giving us an opportunity for creating more breakthroughs in technology. Thanks all the delegates from domestic, international. I think it's a very good, I think if you really start with the first program Aura did in way back in Bombay. So it is a great, in fact it's something like it's great inspiration for all of us here, because ultrasound guidance has been playing a very critical role in regional anesthesia. I think that's very important, and Aura is doing a fantastic effort. So I'll just run through a few things what GE's healthcare is all about doing. It's very important because technology and medicine has to go in together. That's very, very important. Until the GE engineers work very, very hard and get the best technology, it's very difficult to get the best medicine results out. So we just touched upon the point of care ultrasound. Just see a small video here.
Doctors have been saying it forever.
Let's take a look.
But they've never actually been able to do it like this.
Let's take a look.
V-Scan from GE Healthcare, a pocket-sized imaging device that will help change the way doctors see patients. That's better health for more people.
I think it's a very nice, so we'll start with anesthesia here. So it's quite on a humorous note. So everyone might be thinking what is GE is all about. I think GE is one of the, everyone knows about Edison. We always teach our children who is Edison. So he's our founder of this company. So it's a great privilege to be a part of the great organization called General Electric. So it was one of the company way back in 1896. And the most strongest companies, if you see, we are not in healthcare, we are in aviation, energy, oil and gas, power, transportation, home business, and G Capital. So it's a very diversified business. It's one of the strongest businesses in the world. And as far as the ultrasound is concerned, I think that's what we have been discussing. In fact, a lot of doctors are talking about, faculties are talking about the role of ultrasound in regional anesthesia. So I'll be focusing more of ultrasound in regional anesthesia, how it is making an impact. It has already made an impact in radiology, obstetrics, cardiology, surgery, everywhere. But the thing is how it is making an impact in regional anesthesia. So this is what it is. We have been diversified in women's healthcare. You might be in Volizon. Volizon is always a dream product for every obstetrician. The 4D what Volizon delivers is always a dream product. So GE always gets the best things out of it. Cardiovascular, the Vivid series. You go to any cardiologist in the country, he talks about Vivid. Vivid is considered one of the best. You go to Logic series, one of the best. Point of care, the Venue series and the Logic keys, which has been doing extremely well in point of care, and the primary care, the V-Scan. So we did a recent survey from the last 3 years. We have been almost 45% market share we have in India. So it's thanks to all of you. I think because of all your efforts, we have been able to do it. And here, it's very important. This is one of the very strong subjects what I wanted to emphasize on, empowering technology in the operating room. I think that's what, in fact, the president of Aura, Dr. Balavenkat, was talking yesterday, how technology can really make an impact in operating theaters. I think that's very, very important. So how can we leverage it? How can we go to the next level? Anything, ultrasound anesthesia is nothing new, because the bus Boyle's machine, we have been associated with anesthetists way back more than 100+ years now. The Datex Omedas. So this anesthesia and ultrasound are always together if you really see. So GE has been associated with you longer time. And you see this very important statement. Every few minutes, somewhere in this world, a clinician uses GE healthcare anesthesia machines. What more do you require? This is one of very strong statements. So you have been using ultrasonic anesthesia machines. Now you need to graduate to ultrasound machines. That's what it is. So it's a very transition. So we have been talking about the clinical economics of ultrasound guided procedures. I think everyone talks about this and how it really makes an impact, how ultrasound is beverly, because we are need to talk about drug delivery precision. That's very important. It's drug delivery management. The future of technology in anesthesia is all about drug delivery management, nothing else. So how accurate you are going there. So that is a great challenge for us. So it's very important. You go back, if you see Dr. Hopkins is one of the strong things. He says way back in 15-20 years back in India too, even in obstetrics ultrasound people never used to do it. But today it has become a gold standard. For every trimester you need to do an ultrasound. So today I won't be surprised 5 years down the line with the efforts of Aura, we'll be in a stage where every anesthetist in India will be using ultrasound. Of course, we have a lot of challenges, price, the regulations, all those stuff, but I think we'll be able to counter all these things. And of course, we have been discussing about this ultrasound guidance evolution. We know about how the blend techniques, the PNS, all those things. It's very important because each segment complements everything. It's very important. So we are trying to escalate how to take it forward. And this is a very nice slide about how the general anesthesia, regional anesthesia is better than general anesthesia because everyone wants to go back home faster. So the biggest challenge in point of care is how you make the patient go back to home faster. I think that's very important. So we'll strive how many efforts we can make it so the patient can go back home faster after very safe surgery. So the environment is about this. I think that's very important. I think we have been highlighting about this. So it's a big fundamental change. We have 16,000 anesthetists in the country as per the ISA. So only around 700 people have got registered as per Aura. So that means our challenge is how to get this remaining 16,000 people to get into Aura. So that's a big challenge now. So that's what it is. So everyone comes to Aura, I think they really take a very strong message. And PA and NABH guidelines, I think that's very important. So because most of the people we work in hospitals, we know what is NABH guidelines it's all about and talks about patient rights and patient safety. And what I feel is this point of care ultrasound can make a deep impact in NABH guidelines. That's very, very critical. So how can G help you? The $1 million question. So you might be telling, oh, the vendors, because we want to sell the equipment. We don't want to sell the equipment. Basically, because selling is always automatically it happens. You don't have to do anything for that because it's more about patient safety. It's all about that. So how can G help? As we go forward, we need to get engaged with training, selectively forget the past, what has happened, learn new things. That's what strive for balance, embrace the culture, communication often. I think very, very important. And the biggest challenge, I think the biggest challenge you pose as for the vendors for us is reduce the cost. You must mean that's a very good thing because it's very important for India. We can't expect the same thing. Improve quality, increase access. I think we are striving very hard for doing this. So how can G Healthcare address new challenges in region and pain management? So it's all about seeing the needle, accurate anatomy, accurate motion. I think we need to go beyond this. I think that's very important. Now today, this year, G Healthcare, point of care ultrasound, will focus on pediatric anesthesia. That's the theme we'll be following up. Because everyone talks about adult anesthesia, but no one really takes care of our children. So how children, for pediatric anesthesia makes an impact. So today we'll be launching this product. Shruti, why don't you come forward? Dr. Sandeep Mutha is here. Dr. Sandeep Devan, sir. Dr. Sandeep Devan, sir, please. So I request, we'll be launching a product called Venue 40, dedicated for pediatric anesthesia. So we request Dr. Sandeep Devan to on the machine, switch on the machine. So this equipment has been designed for pediatric anesthesia. It is an 18 megahertz probe, it is an hockey stick probe, which has been designed for pediatric anesthesia. So thanks, Doctor. I think he has been one of the forefronters of developing the technology and he has been a lot of inputs. Thank you very much, Dr. Sandeep Devan. Yeah. So, yeah, sure, yeah. So this is one of the few things. Then we talked about all the technology, and probably when you come for the booth, we can share you about a lot of things which are available. And apart from that, we also have a lot of console machines because a lot of P&D regulations, people talk about portable, all those stuff, because we also have console machines. So you can see a complete console range. So G has consoles as well as compact machines. So that really makes a lot of difference for your purchases. So it's very important, the user, buyer, payer, the surgical teams, C-suites, patients. So what is stopping us to practice ultrasound guidance? So we need to talk on patient rights and safety. So that's what, in fact, everyone talks about. Every faculty here talks about this. If you want to do a successful block, know your anatomy, recognize the anatomy, practice. And when you go back home, back to your, probably on Monday, I think you need to work on this ultrasound. It's very important. Not what we do is, we tell them to share at least once in a week, share the ultrasound machine with the radiologist. Or every Saturday, we should share the ultrasound, tell the radiologist or the gynecologist, give one machine to me, every Saturday I'll work on ultrasound. I think that's the way we have to go forward. So Logic is a product which we are focusing on, and this is what Logic, the Venue 40 is all about. Easy to use. So probably when you come to the booth, you can have a little more awareness about the product. So I thanks Dr. TVS Gopal here, Dr. Bala Venkat, and Rushali Pandey, Dr. Sandeep Devan, Satish Kulkarni, and the entire Aura team. I think you people have really done a great job. My only request is, Dr. Sandeep Devan, is how can you get the USRAs to come here more often, probably next year. We can have the USRA, the European School of Regional Anesthesia, to get into India and do more programs like this. And thank you very much for your patience.
Thank you very much. I think it's time for the European Society and American Society to call us.
Absolutely, perfect. I think that's a very good, optimistic thing actually. So the more white papers we need to create and give them, I think that's very important. Yeah, thank you.